Hi, all. You're watching another episode of Ask the Experts. Today, we're joined by Layla Saudi, founder of Sana Relief. Layla, thank you so much for joining us.
Thanks for having me.
Wonderful. So you started Sana Relief to address health challenges across the Middle East and North Africa, especially among refugees. What inspired this great work?
So I was born and raised in Jordan, and I'm actually currently in Jordan. And I think I was about 12 or 13 years old when I started going to refugee camps. And back then, it was a Palestinian refugee camp. And I went with my uncle, who's an orthopedic surgeon, and he was basically doing some pro bono work. And at 11 or 12, I had no technical skills, right? So all I could do was basically make sure that people were waiting in line to see him. And then I figured I could just talk to people, right? And so I started talking to somebody in line, and she was not much older than me, but married to somebody who was about 50 then, and just exposed to debilitating rape. And it was then and there that I realized that I wanted to spend the rest of my life working with refugees, and particularly really addressing mental health. And it was then that I realized it was one of the most urgent issues, and it remains an urgent issue today. Then I had the privilege of sort of being able to move to the States and, graduating from universities in the States and then working there. I started working at Stanford. And what I really wanted to do is sort of leverage the technical skills and the incredible resources available at universities like Stanford to better support refugees in the Middle East. And that's essentially what Sana Relief is. It's a program based out of the Stanford School of Medicine.
That's wonderful. Thank you for sharing that background. So you mentioned that you live in Jordan now, and the Syrian refugee crisis around 9 years ago obviously strained Jordanian systems with the influx of refugees on top of host communities. So you've seen these challenges firsthand. So tell us about them. What are some of the primary challenges for young people for their health and well-being?
Jordan tends to be a pretty low resource country, and there are challenges. And a lot of those just go back to sort of just access to healthcare, right? Let's talk about mental health as just an acute example, right? To sort of put things in perspective a little bit. So Jordan is home for about, let's say 10 million people, probably a little bit more at this point. And we know that there's about 100 psychiatrists in country. That's it, right? And less than 100 clinical psychologists. So access to healthcare is a challenge and was a challenge for sort of native Jordanians, let alone sort of addressing the mental health burdens that come with refugee populations that tend to be great, right? And it's a lot of unaddressed trauma, depression, anxiety, etc. So access to healthcare is a major issue. Access to education remains an issue also. And that's also for those who access education, there's also an issue of the quality of education. A lot of refugees tend to stay sort of in border areas, where access and quality of education remains poor. So even though it's been 9 years, we still got a lot of challenges and a lot of work to do.
Thank you. And now on top of that, there's COVID-19. So how has this pandemic added sort of another layer to those challenges?
Yeah, it's added a lot. So I think we're sort of all in uncharted territory, right? We're all everybody thinks they know what they're doing, but really we're just winging it as we go. But the government, sort of keeping in mind what our limitations are in terms of resources, the government made a super early decision, back in March, to say we're going full lockdown. And so, as you can imagine, granted that we're in May, full lockdown is literally for the vast majority of this time that people can't drive, they can't go to school, they can't work. So I think the government took a really sort of a humanitarian and a just stance in saying we're going to put our people before we put our economy. But that's also meant that for a lot of refugees who depend on day-to-day labor, those jobs have been taken away, right? So there's no sense of income. There's no sense of stability for these refugees who rely on those $2 or $3 that their kid brings home, or the $10 that the husband brings home a day, right? And so that's led to a lot of food insecurity issues, a lot of mental health issues, and just sort of compounded adversity one after the other. that is still not resolved. And I think the government is doing what they can with food assistance, but we're still falling pretty short. Unfortunately, like a lot of us have turned to like Zoom for school, right? And our nephews and our kiddos are like attending classes and everything is okay. But for refugee education, that's not often the case. And so it means, again, that their education has been disrupted.
One thing that we often say on top of the challenges that you mentioned are refugees aren't able to social distance in a refugee camp. There's just physically not space for it. And I think you highlighted a lot of those challenges really well. One of the other things that you mentioned is mental health. So how is the pandemic impacting mental health, particularly for already vulnerable refugees?
It's been awful, honestly. And I think there's sort of mental health and just fear, right, from the pandemic and what this means. And there's also sort of mental health from just like structural violence factors, right? So this like lack of access to education, lack of access to employment, etc. What's also particularly concerning, as it has been for all of us, is that we have no idea when things will, quote, normalize again, right? Or like we'll go back to normal, whatever that looked like, and everything will be okay. We just don't know when that looks like and how that looks like yet. And I think for refugees, it's been particularly concerning. This idea of like how long can we like physically even go for without adequate access to, you know, employment and thus everything that employment and money brings with it. Even today, I've been talking to Syrian families on the border of Syria, and there's this one specific Syrian woman who lives on the border of Lebanon and Syria, and she's incredibly vulnerable, and I'm happy to go into her story, but she's essentially, her daughter suffered a traumatic brain injury and consequent like seizures, epilepsy from that. And she's had no money at all because she had to rely on like day jobs, right? No money at all, and thus no access to sort of like any of the meds that her daughter needs. And there's just no way around it. And so it's been really, really, really hard.
Absolutely. Thank you for sharing that. One thing that we often find in our work is that children are so resilient, and they can come back and they still have joy despite hardships. Are you finding that in your work right now?
Yeah, absolutely. There are beautiful examples of resilience, and I managed to sort of see a refugee family actually today, and they live in like an informal tented settlement, right? So like a camp, like a tent outside of an official refugee camp, right? And so it's literally what you think of as like a makeshift tent. And they're from Syria, and we talk, and they've been living in this informal tented settlement community for now 6 years. And I talk to the kiddos, and they're like beaming with joy, right? They're just like running around. They're like making makeshift toys. They're playing hide and seek. Granted, this is a tent in the middle of a desert. And they haven't had like good access to food in a while. All they've had to eat over the last like week has been cucumber and bread, and some water. And this is Ramadan, right, where people are like breaking their fast, and but they've been able to break their fast literally only on bread. But the kids are just jumping around and having a great time, and it's a beautiful thing to sort of have that resilience. And I think it's our responsibility to not just rely on their resilience, but to sort of actively work every single day to better their conditions and to better their qualities of life so that they don't just depend on that resilience.
Amazing. Where do you see your work going from here, and what do you sort of hope for the people of the region that you work with?
I worked almost exclusively on refugee projects at Stanford for 3 years, and then only about like 6 months ago did we decide to start Santa Relief. And it's this idea thing that I realized is we can't build sustainable programs for refugees if we don't also incorporate refugee host communities, right? We can't just continue to build sort of parallel systems. And so if we're gonna make things better for refugees, we also have to make things better for Jordanians or Lebanese or et cetera, et cetera. And so what I'd like to see happen is we continue to get funding at Center Relief and expand the program so that it becomes sort of one of the largest programs focused on the health of populations across MENA, based in the US, but actively here. And to really just like build research and implementation capacity.
It's wonderful. lastly, how is quarantine going for you? How are you able to continue with your work and get things done while under lockdown?
Yeah, it's been challenging. I feel like we all kind of started with this sort of optimism, right? Like this is gonna be the time when we start meditating and we start working out and we start reading, and I think for me at least, it's come in waves, right? It's come in waves of being like, okay, we got this. Like, I can do it. Work is exactly the same. Everything is the same. To then just realizing that it's not, and that's okay. And maybe I don't want to be productive right now, right? And so I think part of navigating COVID is just being super honest and transparent with where you are and how you're feeling, and understanding that you're trying to take care of yourself in the midst of sort of a global pandemic, right? The first objective isn't to be productive. The first objective is to make sure that you're okay and others around you are okay. My work with refugees has been impacted because traveling across provinces has been officially, like, the government has said no. But I've been keeping in touch with the families I know and sort of facilitating access to NGOs where they are. But as soon as restrictions start relaxing a little bit, I'll be on the border of Syria again pretty soon.
Thank you. Thanks for that advice and for sharing all the great work that you're doing. And thanks to you for tuning in for another episode of Ask the Experts.